Thank you very much for coming. It's really nice to see everyone here. My name is Daragh. I'm head of service for the neighbourhood support teams, occupational therapy and health and social care connect. I will come on to those teams shortly, but first I'd like to talk about me. I've worked in adult social care for 20 years, over 20 years, and my father still doesn't know what I do. He doesn't know. He's asked, I've answered, I've tried to clarify, but he doesn't know what I do. And there's a reason for that, because in adult social care we do a lot of things. We do a lot of things that are put together. Unlike some of our colleagues that we work with, so people, doctors, nurses, police, they've got very clearly delineated roles. We know what they do. Society knows what they do. And that's why you have so many television shows about those roles. There are none about adult social care that I'm aware of. And going back to that, with that in mind, when I eventually tried to explain to my father about what I did, I said, listen, do you remember that cop show, Hill Street Blues? Yeah, and this is a show from the 80s, so you're probably all too young to remember that. And I said, I was like Captain Frank Furillo on that. I worked with the people who worked with clients. I didn't have contact with them myself, but that's what I did. And I used that frame of reference because it was the only way to make him understand. He hadn't had a social care assessment, he hadn't had safeguarding, he hadn't had OT. So he wouldn't really know what adult social care was. And it has been rebranded from social services as well, so that's another factor in that. However, we need to know what we do, and we need to be able to say what we do. And I've talked to colleagues about this, and fundamentally, this isn't, you won't find this on the East Sussex website now, this is Daragh's version of what I think we do. We help people to manage the risks associated with their lives, whether that be because of their lifestyle, their health, and that's kind of it in a nutshell. Now, that's not a neat little tagline, hence you don't get a movie being made about it or a TV show, but that's what we do. And the key thing for us is that we help people. Whenever anyone leaves, if they retire or they've been working with us for a while, and I'm asked to give a speech, I'll always say, always remember, you've helped hundreds, if not thousands of people. You mightn't have had that feedback, but that's what you've done, because that's what we do. And there are many different ways in which we do that. Sometimes you're part of the process which leads to that, sometimes you'll be doing the various assessments, but that's fundamentally what we all do. As regards coming into our service, so what I'll talk about now is the process by which we help people. And this is from the client's point of view, and this will describe the services that we provide. So somebody will come to us with needs, and they can be referred to us, and they'll be referred through to Health and Social Care Connect, HSCC, and they can come from police, other local authorities, GPs, nurses, members of the public. There are various ways in which they get referred in. And Health and Social Care Connect is quite unique because we look after health needs and social care needs. So we will refer people on for health services via community nursing, and also via the more adult social care services, and also the preventative services as well. Just need to take a drink, hold on. So in HSCC, we've got 4 main hubs. We've got the safeguarding hub, which deals with safeguarding, looking after people, responding to concerns. We've got access, we've got assessment, and we've got health. Health will be processing the health referrals. What all the staff in HSCC will do, as much as they can, is they'll signpost people to other services that might be more helpful. We'll try not to take people in, because what we don't want to do is, start people on that process, take down all their details, and then find out, well, I didn't want you to do that. And they just wanted a little bit of advice. So we will try and signpost wherever possible, but an awful lot of the cases then come into services. They go into health services, they come into our neighbourhood support teams, they come into our mental health teams, and they come into our LD teams, although there is a slightly different route for them. HSCC is a hive of activity. They get loads and loads of referrals coming in. And staff in HSCC learn about adult social care through osmosis. You'll hear about all these cases going on. You'll find out about this. You'll find out about that. You'll find out about JCR. You'll find out about OT, about social work, about the other areas of work that we cover as well, LDDPS, older people services. So what we find in HSCC is a lot of people go for there. It's kind of like an academy, go from there and we'll develop into other teams. You'll get that knowledge, and a lot of people do move on. Just to say as well, I have talked to a lot of management colleagues, this has probably been said before, and ops managers and heads of service, and they all generally started work doing care work, doing answering calls, doing the stuff that, the intake services before getting skilled up and then progressing and then progressing. So once HSCC has decided, okay, this person needs an assessment, it'll be what type of assessment. If possible, we will signpost to prevention services, so that's OT clinics, where we look at people's needs and don't kind of take them into the system as such and try and enable them to be as independent as possible. Or they will refer into services, like I mentioned, learning difficulties, mental health, or the neighbourhood support teams. With OT, OT have OTs and OTAs in the clinics, and there's OTs in the teams, there's OTs in the housing services to do with the district boroughs. And in general, what OTs, I'm just looking around, are any OTs here? In general, what OTs do is they will enable people to be independent in their environment by providing techniques or equipment, so hopefully they'll be able to look after themselves. Or they'll provide equipment so that it's easier to help look after people. OTs are an interesting role because when I worked with multidisciplinary teams in Hackney before, I had a team of OTs, physios, social workers and nurses, and the thing I noticed about OTs are they could kind of touch a bit of everything there. They could do a little bit of physio, tiny little bit of social work, a little bit of kind of nursing type stuff. So it's a very versatile role. That's one thing I will say about that. It also involves using a tape measure a lot. That's an OT joke, no disrespect, that's funny, yeah. Yeah, and then we have the other services, which would be the adult social care services. These would be the assessment services. So somebody needs an assessment. You've got a need. We need to assess the need. We need to assess the risk. So at HSCC, they'll determine whether it goes to, like I said, mental health, learning disabilities, or neighbourhood support team. I'm going to have to talk about LD and mental health a little bit. They're not my areas, but they are my colleagues, and I want to represent them. So learning disabilities, I think what everybody knows what that is. That'll be people who have general impairments, global developmental delay, and they'll have had them all their lives, usually. And they will usually be known to services from Children's Service, so a lot of those cases will not come through HSCC, but some will. So I won't dwell on them. And then the mental health services will deal with people who have usually a mental health diagnosis of some sort. Now, here's where it gets a little bit tricky for HSCC, of some sorts. So what, is that a diagnosis or is it not? Because sometimes people will present as if they have that need, but not have the diagnosis. And that's part of what HSCC has to do in sorting that out. But in general, we'll move people through to mental health services if they have that kind of history and that's what's indicated. And then we come to neighbourhood support teams. I often wonder about the name, the moniker neighbourhood support teams, because does it describe what we really do? Well, what do? We do assessments, assessments of care, assessments of risk, mental capacity assessments. We do reviews as well. We arrange care, we manage care, we do safeguarding inquiries, and it's all that kind of, like I was saying earlier, that part of keeping people safe. It's very complicated. We meet people, we hear the stories of their lives, we kind of assist them with making them as independent as possible, but they will generally need an awful lot of support from us. So neighbourhood support teams. The age group for neighbourhood support teams would be 18 plus, and it's generally adults with physical disabilities or older people who need services, or possibly people who have low levels of mild autism, shall we say, or mild learning disabilities. And it's quite a mixed service that we provide there. Like I say, it's very interesting, and what we are finding is that people's needs are getting more and more complex. We're getting these situations where, we haven't come across that one before. So we'll have to work with managers and with our teams to figure out, come up with inventive, creative ways in order to meet people's needs. Then we come to the managers themselves. So the managers have come up through the ranks. Inevitably, they will be very familiar with how these services are set up. And they're there to make sure that the job gets done. They won't be doing it themselves. They won't be doing the assessments necessarily, but they will be ensuring that those services are run safely. And then we also have to give a big shout out to the admin, who are so helpful in the work that I do. I'm always very grateful for them being there and providing that support, because as managers, we definitely do rely on them quite a lot. So what will happen then is we'll set up services for people, and then we will monitor those services, or people will come back into us as their needs change. And that's kind of the client journey to some respect. So going back to the start again, what we'll talk about is the career journey. So coming in through HSCC, there are various different roles in HSCC. So the roles that you would get there would be assessment officer. So you'd be assessing people over the phone. Senior assessment officers. You've got senior resource officers there. You've got admin there. You've got senior practitioners there, and managers. And they would be, those roles are very much involved in, progressing the referral further. So you learn about the various needs. Coming to the OT service again, what you would have there is admin, occupational therapy assistants, and OTs. And there can be quite a pathway there from admin to that kind of assessment role, which would be an occupational therapy assistant, and then go on to an occupational therapist via whether it's training or whether it's via our apprentice schemes. And then within the teams themselves, the assessment teams, so that's LD, mental health, and the NSTs, you will have admin, resource officers, senior resource officers, social workers, senior practitioners, practice managers, and operations managers, and then me. And there is that pathway kind of mirrors the way in which people come into us. So the people with less experience will sometimes come through HSCC. You can come into other teams as admin, but you will progress. Admin's a really good example, because at a meeting, you'll be documenting all of this information. You'll be taking minutes. So you will find out about various different complex cases, how they're assessed, how the risk is managed, and inevitably you might lead towards that moment in time where you think, I think I could do this. And that's what we want from all our staff, because as managers, what we want to see is all staff progressing as much as they want to progress. If you're happy doing whatever role you're doing, that's great. And to be honest with you, managers don't want to be recruiting all the time, because in case you've noticed, there's an awful lot of that going on at the moment, and it's it takes up time, and from a management point of view, it's like you will have a vacancy. There'll be a gap somehow. You've got to fill that gap, and when that post isn't filled, well, who's going to do that work? But having said that, we are all fully committed to developing staff and letting staff go on training. Hence, we've got the apprenticeship program. Hence, we've got various other training courses that staff go on that will come up via supervision and team meetings. As regards career progression, that's kind of it. What I wanted to talk about, seeing as it's careers fair, is careers and how they work within the organization. Recently, I've studied for the strategic workforce planning the movement that we have through teams. So we have staff will leave the organization altogether sometimes, or staff will move within the organization. And there are certain teams that staff move from, and those teams are more like academies. I'm not going to say who those teams are, but those teams are basically growing staff for other people to benefit from, and the other teams are going, great, thanks for your staff. You recruit somebody else now, yeah, thanks. we appreciate that. I've mentioned it at many meetings. We know who those teams are, and they're the bigger teams, basically. And that's something that we've got to do. But we've got to make things, how should I put it, meaningful. We've got to make things, we've got to be very clear with staff from the word go. You've got to have supervisions, we've got to have appraisals or the maximizing performance conversations where we're talking about, is there anything that you would like to do? Inevitably, that discussion will have happened already because the staff member will have told their manager, I'd like to do this, I'd like to do that. Is such a thing possible? And that's what we want to see more happening. Dare I say it, we will be advertising more, but hey ho. Because what we want to do is we want to retain staff so the staff stay with us and develop elsewhere rather than staff moving off somewhere else. Now, sometimes that happens. People move house, etc. That's to be expected. But we're very much committed towards doing that. And there's an awful lot of work in the workforce program, which has probably been talked about already. And we're looking at that. We're looking at what the issues are. We're looking at how we can address these things. There are a lot of initiatives at the moment, and I know Paul is working on a few, to retain staff, to recruit staff. But that's really what's important for me, in that the staff that we have, you've got to retain them, you've got to train them, and we've got to ensure that careers progress wherever possible. And that's pretty much all I have to say.